Hey, welcome to Care Thriving. Today we're going to talk about home health nightmares. So if you watched my last video that was called, my child's in the hospital, what do I do? Um, we're going to go from that point and we're going to jump forward about a year and a half. So during this time, we get a phone call from my dad and he says, son, your mom's had a stroke. She's in the hospital, right? So all of a sudden, I find myself managing medical care for three people: my son, who's on hospice, my mom, who's in the hospital suffering a stroke, and my dad, which, unbeknownst to us, was in late stages Parkinson's dementia, right? So, in a nutshell, we get my dad in the house, and we're taking care of him, and we figure out that things aren't quite right, right? So I get him to the doctor, and I have his care transferred to a care facility locally, and I get him hooked up with a new doctor, and I wheel him in. And at this point, he's in a wheelchair, right? And I get him into the doctor's office, and the doctor looks at me, kind of puzzled, and he's like, "What happened to him?" And I'm like, I thought you could tell me, right? Because none of this has been identified, and his care was like off the charts at this point, right? So, oh, actually, to back up a bit, what actually happened is that while Dad is in the home while we're caring for him, in those first couple of weeks, we had a retired physical therapist who was giving some respite and quote unquote a little bit of therapy to our son, right? And she sees my dad walking one day when she's visiting, and she goes, "How long has your dad had Parkinson's?" And I'm like, "Parka what?" Right? So I have no idea, but she saw how he was walking and identified it immediately. So in the back of my mind is that if he's getting medical care, he's been seeing doctors. Why hasn't this been identified a long time ago? He was just seen by his doctor a few months ago. Why didn't they identify that he was having these health issues? So come to find out, what happened is that Dad wasn't actually seeing his doctor in person. He was doing phone visits, which is probably even, and this is pre-COVID, okay? This is pre-COVID. So, and it's probably even more of an issue now post-COVID. So it's something to be aware of, right? So if you have an elderly parent and you're not able to visit them or kind of track what's happening to them medically, and they could be saying like, yeah, hey, son, daughter, everything's great. I just saw my doctor. Well, they might not be seeing the doctor in person. They might be calling in. And the old story, where the son calls his dad and he's like, "Hi, son, here's your mom," right? My dad was kind of like that, right? So if your parent who's elderly is having these type of conversations with their doctor, "How are you doing?" "Oh, great. Just refill my meds. Bye," right? The doctor's never going to have a chance to identify what's happening, and there could be a serious medical issue, right? And we notice this happening when you go by and you visit the home and you start finding, there's more burnt out light bulbs that aren't getting addressed and things like that, or things aren't happening around the house. Maybe things look more disheveled. These are all really important clues that you should identify right away. So anyways, long story short, we collaborate with the doctor and we start getting things going. We're finding out that there's much larger issues here. And I explain that, I'm at home by myself and I'm dealing with a medically fragile child who's on hospice and I'm limited in my ability of what I can do. And he says, "Well, let's get you some home health. Let's get him on home health and work from there." And I'm like, "What's home health?" Right? I didn't know how any of this works, right? So it sounds like a great idea. So we get them signed up for PT, physical therapy, OT, occupational therapy, and a nurse, right? I'm like, this is going to be really helpful. So the hospital or his insurance company, there's a number of different home health agencies you can go through. Some are internal to a local hospital, and they're usually nonprofit. The hospital could be nonprofit or for-profit. And then there's a lot of what are called separate private for-profit agencies that do home health, right? And this is where the problem gets in. A lot of these and this is not to diss anybody that's working in the home health field. We've had some great home health people and some really bad home health people. And I understand that it's a difficult job, but all I'm going to share is my personal experiences. And if you don't know how this works, things to watch out for. So, an example being that they had initially gone with a private home health local agency that coordinates this, right? So And I'm thinking, great, I don't know the difference, right? So one day, all these people show up, right? And we get like a nurse that shows up, and they rush in, and they got their bag, and they're taking the blood pressure, and they're doing the thing, and they're asking all the questions. And then about 40 minutes later, the PT walks in, and they rush in, and they got their bag, and they're taking the blood pressure. And I'm like, well, they just did that an hour ago, but I don't know. I guess this is what they do, right? And they do all the things. And then about another hour later, then the OT comes in, and they rush in with their bag, and they pull out, and they take the blood pressure. It's like the third time in a 4-hour period my dad's had his blood pressure checked, right? And so this goes on, and then they show up the next day, and the same thing happens, right? And then it goes on. I think the next day they had like 4, maybe 5 visits. I think it was 4 visits the first week, right? And I'm thinking, this really seems excessive, and I'm not really sure what's happening, right? Does he really need his blood pressure checked 3 times a day? I mean, he's not in the ICU. He's having Parkinson's and some dementia issues, right? So what was happening is that things were turning into a nightmare, all right? People are showing up on random times. They're doing the same thing over and over. My dad's anxiety level is going through the roof because he doesn't know who these people are, and they're rushing into the house, and he's getting his blood pressure taken like 3 times a day. Nobody can answer any questions. Nobody can give any views to what was happening in the future, and it was a nightmare. It was a complete clown show. At this point, I start asking some questions. I'm like saying, hey, can we like schedule this or spread this out? And they're like, oh, I don't know. You have to talk to the care coordinator. And I'm like, oh, who's that? I'm like, well, you can call this number, and blah blah blah, and then Sally will call you back, right? And then you find nobody's calling you back, and then you're into the second week, and you start asking more questions, and you're like, look, I think we should like slow these down and spread these out a little bit, right? We're into our second week, and I'm not really sure what the roadmap is for this, and I want to make sure my dad's getting the care that he needs. And how long do these visits go on, right? Nobody knows anything, and nobody can answer any questions, right? That should be your first red flag. And come to find out, essentially what was happening is that this was a private healthcare agency, and I'm sure anybody in the medical field has some degree of care for what they're doing, but the focus wasn't on that. The focus was on getting through the appointments, right? They wanted to get up the appointments. They wanted to use up the time that the agency had been allotted and then get on to the next thing, right? The care for the person was really being secondary, right? Because the person doesn't need 4 PT, OT, and nursing appointments in 1 week, and he doesn't need his blood pressure and vitals checked 4 times a day. That's unbelievably ridiculous. And then nobody was able to answer me how long this was actually going to go on. Right? Or is home health, is it a week? Is it a month? So come to find out, a lot of people will say, well, home health is just a short-term thing, like 2 weeks. So you can actually have through Medicare, or through insurance, home health can go up to 60 days or even longer. Depending on what the need is, it just needs to be specified and justified by your doctor, right? So this is a second thing. When home health comes into your house, they should be listing our criteria and doing assessments of progress. And you should ask for those assessments of progress, right? Because those assessments of progress of what's happening are how your doctor is going to justify how long your loved one is getting home health or getting care in the home, right? And you should be able to organize your appointments. Like at one point, it was so ridiculous, people just started showing up, right? So you really need to push back and make a schedule when home health starts coming over, right? If you're dealing with a person who has Parkinson's or dementia issues, it may be hard for them to all of a sudden suddenly having this circus coming over 3 people a day all week, right? Maybe you want to spread it out. Maybe the nurse comes over twice a week or once a week, and then PT and OT, should make some goals, some black and white goals of what they're going to do for your loved one. And then you can schedule time. You say, well, I want you to come over once a week or twice a week, right? And have it organized, and then set the expectation for your loved one so they know what to expect every day. It makes things much easier, especially for seniors or people dealing with dementia that might be concerned that all of a sudden these people are coming over that they don't know. So this is very important. So set expectations, set ground rules. Don't be afraid to push back at home health. And ask for copies of the assessments that they're making, right? And even especially when home health when they close you out. Tell them, request, don't actually demand a copy of the first and final assessment that they're making on your loved ones, right? Because that's all going to be based on the care going forward, and if home health is going to be extended for you or not, right? And what we're really talking about is quality of care. This all comes down to a quality of care for people that really need it the most. Another issue is that when you have a senior or you're involved in elder care, you need to be aware of what are called ADLs, or activities of daily living, right? So home health won't help them specifically with ADLs, activities of daily living, but they can document how they're addressing these. Are they able to do these? And these are very important, because if they don't document these, you're just going to get this generic assessment where it says, oh yeah, he's doing great, big improvement. And you're like, where? How is this documented? What's the improvement? Where's the improvement? And if your doctor doesn't have these, they're just going to go, yeah, looks like he's doing great. And that might not be the case. So take some notes on this. So some areas of ADLs would be like ambulation. Ambulation is how is your loved one able to walk and transfer? This is a big issue. Like my mom, who came back from a stroke, she had walking and balance issues. Dad had Parkinson's, which really affected. That's my little guy in the background. He's not on hospice anymore, by the way. So, the ability to transfer, use a walker is a big thing, and you need to document this. If they're having a lot of issues, maybe they need more physical therapy, and maybe they can document how they can make improvements in this regard for your loved one. The second issue of an ADL would be, continence care. Are they able to go to the bathroom? And another thing is important to be present during these visits, if you absolutely can, or have somebody be present during these visits. Because a lot of times a senior or an elder, they might not want to talk about these issues, or they might hide them, right? Maybe they're having real difficulties with continence or personal care. And if they say, and the nurse comes in and says, oh, how's your toileting doing? And they're like, oh, great, right? And maybe it's not great. So you need to be there to address and find out if there's areas that need to be helped or not. The third one is dressing. Is the person able to dress themselves? My mom came back from the stroke and was paralyzed in part of her body, and she wasn't able to dress herself. And this was a big issue that could be addressed through occupational therapy. And if it's not listed or identified, nobody's going to know, right? The fourth one is eating and meal prep. Are they able to make their own food? Are they able to identify what they need to eat? Are they eating healthy? Do they need help cutting up their food? This is also another issue. Number 5, grooming and shaving. Are they able to wash themselves? Are they able to bathe? Are they able to get in and out of the bath? That's important to identify. Issues with a mobility. Are they at a falling risk? The physical therapist and the nurse, they should be able to identify clearly if the senior is at a risk for falling, and there's areas that, there's things that you can do to address that. Medications. My dad having dementia, early and advanced onset dementia, he wasn't able to do his medication management, right? So if you have a senior living by themselves, and if home health comes in and they don't identify these issues, this is a danger. Hearing issues. At what point we thought my dad had hearing issues, but it ended up being dementia. It wasn't hearing at all. So those are 7 or 8 areas of daily living that you should write down and make sure they're addressed when home health comes over. It's really important. I guess the takeaways are, when home health comes over, I would really recommend that you go through, not through an agency, but call your local hospital, and you can actually say, you know what, I want home health services through this agency. And a lot of times a larger hospital will have their own internal home health and hospice areas, right? So they'll do that. Don't go through a private agency if you can help it, unless you already know they're really good. 2, make sure you get specific criteria and assessments written down. Don't let another thing to watch for is that if the PT/OT nurse is coming in and they're doing their chart notes for 40 minutes instead of actually actively working with your loved one, That's a big issue. So we had this one situation where, you know, I'm kind of in the background observing what's happening, and I noticed that this one PT was coming over all the time, and she would come in and sit, and they talk about the weather, and they do this, and there'd be a lot of idle chit chat, and they talk for about 15 or 20 minutes, and nothing was really physically going on. And then she would pull out her laptop, and she'd be on her chart notes, and she'd do chart notes for like 30 minutes, chatting back and forth. And then it's like, okay, great, we'll see you tomorrow, or we'll see you next week. And nothing was actually happening that was benefiting the client. So, if you notice things like these happening, I would say, you always want to give people the benefit of the doubt. But I'd say, if you see this happening the first time, it's probably not going to get any better, right? So, you should feel completely comfortable calling the agency and requesting a different person. Just say, or find out who the person is, and put the health on hold, right? Say, you know what, I need to clear up some things. Let me schedule another appointment next week when somebody gets back for me. When Sally calls me back, then we can resume appointments. Why don't you mention, could you have Sally call me back, right? Try to put a real short leash on this type of thing. And then you can call, the care manager or whoever is there. You can say, yeah, can you give me some examples of what I can expect, that a PT or OT or nurse would be doing during their time in my home? And they'll say, oh, sure. They'll give you some prime examples. And then you can say, you know what, I'm not seeing those actually happening. I think it'd be best to request a different person to work with my loved one. You should definitely, when you're dealing with people that are vulnerable in society or the elderly, we need people that can advocate for those who can't advocate for themselves. And it's very, very important. Okay, well, that's all I got. I hope this has been helpful. Like I said, it's hard if you've never been through this. You really don't know what to expect. And, we're just trying to make sure that if you're in a similar situation, that your loved ones are actually getting the care that they need, and that you don't get taken advantage of or turn your home care situation into a circus. So anyways, I don't, what is this, like 16 minutes long? Nobody's going to stay and watch this. So maybe I'll just put the bullet points at the bottom, or maybe I'll make a 30-second edition for all of us with the short attention spans. But anyways, if you like this, like and subscribe. We're really trying to share helpful information. So appreciate your time, and we'll see you next time. Bye-bye.